Tonight, we're going to be looking at the adverse effects of oil and gas extraction, on which fracking is part of that process. And it's only part of it. Not that it's easy, but that is part of the process we got to be concerned with. We're honored tonight to have two physicians with us. I'm glad they've taken the time out to give this presentation tonight, because I think it's critical. It tops off the three presentations. We had one on the atmosphere, the actual operation at the well site, what fracking is all about. And this is strictly about health. Well, it covers more than that, but it kind of brings everything together for us. Dr. Carroll is an MD. He's a board-certified family physician who is currently a solo practice in Fort Collins. He completed residency in 1992 at the Fort Collins Family Medicine Center, matriculating from the University of Cincinnati School of Medicine. His bio is interesting, by the way. His undergraduate degree was in mechanical engineering from Colorado State University, and he entered the U.S. Air Force upon graduation and entered a master's degree program at the Air Force Institute of Technology. How did he become a doctor? He has been in continuous residency in Fort Collins since 1992, and he really doesn't plan on leaving, thank God. He's passionate about protecting our environment. He is grateful to have participated in opposing in situ and open pit uranium mining. In 2007, he worked to have CMS adopt a policy opposing the mining activity, much to the chagrin of the Colorado Mining and Oil Gas Association. Currently, he is actively opposing the dangerous unconventional mining of oil and gas. That's called fracking. He is also a member of the PSR Colorado, and he is on the board of directors of the Northern Colorado Medical Society. Dr. Carroll is with us tonight, and we are happy to have him there. My daughter keeps texting me. Dr. Danforth, he's local here to Loveland. He's been here since 1977, graduated from the University of Michigan and from Wayne State University in Washington in 2012. He helped as the original medical director to form Pathways Hospice and continued to provide hospice service until 2015. He is certified in both family medicine and hospice and palliative care. Currently, he is a member of the Fort Collins chapter of the Citizens Climate Lobby, encouraging our legislators to introduce solutions to climate change. He also serves the advisory board for OLI, a program of educational opportunities for seniors at CSU. He's been married for 45 years and has 2 sons and 3 grandgirls, all under the age of 8. Boy, that's a great age to have them. Tonight, we're going to let those individuals do presentations. Questions can be put up in the chat. Please put the word question in front of it. It makes it easy for Lene Warden, who is our co-host here, for going through those questions. We may change the outcome of this a little bit after the presentation. We'll see how this goes. Also in the chat, when Lene gets time, she'll be typing in some contact points for us, legislators, and also some websites you can go to get additional information that comes from these presentations. So with that, if anyone has a question about our community values, I'll entertain it now for a minute here. If not, we're going to turn it over to Dr. Carroll, who'll be doing the first presentation. I'm going to look for some hands to be raised if you want to say anything, or just unmute and jump in for a second. And you got about 2 or 3 seconds to do that. And seeing none, I'm going to turn it over to Dr. Carroll and let him kick this thing off tonight, okay? Thanks, everyone, for attending. Dr. Carroll, you may be muted.
Yes, I usually get that right. So I was just saying, we won't go into the discussion of why I've spent so many years in institutes of learning, but something about the unknown and becoming a little bit more aware of what's going on is exciting. Yeah, the in situ mining was fascinating. I was the medical president of the Medical Society, and I had a couple of physicians in our group that lived in areas of Colorado where the in situ mining was. And they came to me and they said, this is disastrous for the community. This needs to be stopped. And we were fortunate to get our docs to put a referendum into this medical society, and we got it through. And I think that made a difference at the state level. So here we are on another topic of something is a miss in our area. So a lot of information I'm going to present, but I'm going to try to focus on basically air quality and the effect that it has on our health, and also a little bit on water quality and that kind of elephant in the room availability, i.e. the lack of water. So the two main areas are, what are we breathing and what's it doing to us, and what are we doing to our environment in a couple of different ways. Jim is going to spend a little more time on that, but I do think it's critical to be aware of the downside that this unconventional oil and gas has on our water consumption. So if I don't know of the age of the folks in the room, but there was a time where the air quality in our cities was significantly worse than it is now. And in 1963, the Clean Air Act was passed, which basically said, let's stop polluting our cities, our counties, our world. And it worked. Significant reduction in air pollution, improved air quality. And the benefits was that you had huge amounts of improvement in health and less people going to the doctors, less people going to the emergency room. And that was back then. And that was the stuff that you could see. Unfortunately, now with this new technology, which is amazing, by the way, but it creates this invisible pollutant. And it's not just one simple thing, it's multiple compounds. Methane is what the main process is, but many other compounds come up. And you can see with these FLIR cameras, these infrared cameras, that this is coming out, even though when you look at it, nothing looks amiss. Why is this important? Well, for those of you who are aware of the American Lung Association rating here in Larimer County, Fort Collins, Loveland, Bolt, we have an F grade for our ground level ozone and an F grade for particulate pollution in the 24 hours. And we passed for the annual particulate. And these are complicated because it's not just oil and gas, it's our transportation industry, unfortunately, all the fires we're having. But when you mix it all together, we are really in a bad place, mainly because I think the mountains are beautiful, but they have an inversion effect. But regardless, we don't have to have this level. The reason they've given us an F, this is a graph showing it's a very strange measurement. It's the average 8-hour level over 3 days, over 3 years. But the blue line is what we have been experiencing here in Larimer County. The black line with the circles is the safe area. You want to be below that? Obviously, we are not. Why does it matter? Well, okay, let's go to the health component. We have these beautiful things in our chest called lungs, surround this beautiful thing called a heart. But the breath that we take is designed to give us oxygen and to get rid of CO2 mainly. And that works through breathing through your mouth and nose. It goes into the trachea, into the bronchus, into the bronchioles, and then it finally ends up in these little grape-like clusters that are at the distal area of the lung. That's where the magic occurs. That's where gas exchange occurs. If you don't get air down into that area, you don't exchange oxygen for CO2, you're in trouble. Ozone will cause bronchoconstriction, similar to asthma, but it also creates inflammation and it can damage the alveoli. Another area that we know that causes lung damage is tobacco, and that basically is very similar. It actually destroys this thing called a mucociliary elevator, but it's also a problem that leads to chronic inflammation and damage. So depending on where you are, how much ozone you're breathing, and here's the most important point, how many days are you breathing ozone at what level? We know there are things that exposed to high levels, they're extremely dangerous. But what about the long-term chronic exposure? So you can see it goes from scratchy throat, it goes from a little bit of cough, difficulty breathing, to inflammation, damage, susceptibility to infection, more visits to the hospital, the emergency room. And here's the other thing that Dr. Danforth and I were not taught in medical school is what is your environmental exposure? I mean, sometimes we ask that, especially, if you're working down in a coal mine, you'd really want to know if that individual in your office worked in a coal mine, because that changes everything. But here we are living in pristine Colorado, and we have exposures that are causing inflammation, damage. And most of my colleagues don't even ask about that. Not because they don't care, they just were never taught about it. It was never on our radar screen. So we need to be more aware of that, not only as community members, but as a medical providers and professionals. So here's the non-attainment ozone. If you weren't aware, the EPA has the entire Front Range of Colorado as a non-attainment ozone since 1978, and it's gotten worse and worse and worse. We haven't moved to severe, the worst category, but we probably will. That's going to happen pretty soon. That hopefully will allow our government to enforce strict regulations and do things that will try to clean up our air. But let me show you a correlation here. That is the same map we looked at. This is from the COGCC, the Colorado Oil and Gas Conservation Commission. And Dr. Danforth and I will probably look, that red little dots over there looks like measles or something that's coalesced into this red rash. What those red dots are individual wells that are, some of them are inactive, some of them are actively producing, some of them are abandoned. But look at the volume of these wells. That's, by the way, where the basin is that they're pulling these materials from. But is there a correlation? Is there a connection? And I would argue absolutely. We know there's other contributors, but this industry is a big player in this problem. So hopefully if you attended the other lectures on this, you learn a little bit about fracking. Again, amazing technology, but you have this process of, water transportation. How much? We'll talk a little bit about that. Moving the fluid that's coming out of the well that they don't want out. Storage tanks. You have compression stations. You have pipelines that transmit or that pump this to different stations. And the concern is what is happening down in the ground. Is there potential leaks that can get into our aquifers? Are there leaks that can get into our groundwater? But more importantly, what's coming up from the ground into our atmosphere? One of those things is hydrogen sulfide. I think I watched Scott Danning's presentation. He worked on an oil and gas facility, fracking facility, and he was told, if you smell rotten eggs, run the other way, get your gear on, sound the alarm, because not only could that gas kill you, but it's extremely explosive. That's just one of the ingredients that's coming up out of the well. So when anybody tells you this is a safe process, don't worry, there's nothing that can go wrong, they're either ignorant or they're lying to you. And I say that again, they're either ignorant or lying to you. This is not a safe process that does not cause pollution. These are some of the VOCs, volatile organic compounds. We like them. Methane is one of them. That's what we have piped into our homes that some of you, many of you have running your furnaces at night, have for your stoves. It's useful. The trouble is with methane, if it's not completely combusted, you get carbon monoxide and other things. That's why we want CO2 or CO monitors in our home. Exposure to CO for a long period of time causes severe damage. I actually saw a patient today. I couldn't quite understand why he was so sick, and it turned out that he had a leak in his system, and he had a lot of CO2 building up in his home. Fortunately, he got fixed. He's doing well, but it was invisible. He didn't smell it. He didn't see it. He just was sick, and we couldn't figure out why. These other compounds are extremely dangerous, and they can go from the gamut of, gee, I feel a little sick, I have a rash, I'm nauseated, vomiting. Again, the asthma exacerbation, mainly respiratory, but they can affect the entire body, including increasing risk for cancer, heart disease, increasing serious respiratory disease, affecting the lung, liver, kidney, and central nervous system. What's not on here, unfortunately, is it will be discussed on for the slide, is what's happening to the embryo during gestation. And it's not a good thing. We don't want these chemicals, which can enter into our system through our lungs, go through our bloodstream. We don't want them circulating in our body. Why? They're carcinogenic. Benzene, toluene, xylene. These are all the components that are kind of coming up. I'll talk a little bit more about some of the studies. Obviously, proximity to oil and gas is critical. But the problem is a lot of these things are going into the atmosphere and we're breathing them at the lower levels, but we're breathing them continuously, sometimes with spikes. Fortunately, we have data now with continuous air monitoring. Some of these were done by Boulder Air that shows that there's large fluctuations, and we don't get too worried because in the long term, it's not that much. But what happens if you have that every 3 days, every 5 days, and there's a low level? So the big concern for the medical community, at least in my opinion, is what's causing some of the problems that we don't really understand. And another term that Dr. Danforth is familiar with is etiology unknown. Basically, we don't know. Why do we have cancer? We don't know. Why do we have... Sometimes we can say, yeah, maybe that lung cancer had something to do with the tobacco, perhaps that, but here are some of the studies that are published in peer-reviewed journals. We're going to bring the link up in the chat so you can go look at these. Again, I don't want to say to you, you need to be an expert to read them, but there's published evidence in multiple journals by multiple authors that show the hazards and the dangers of this activity. There's not one article published about the safety. So again, when somebody says to you, hey, don't worry, this can't be that bad, they're not telling you the truth. And the concern I have, and many of us have, are the long-term unknowns. What is going to happen to us over the period of time? So this is one of the resources that anybody can access. It's free. Hopefully the link will be in the chat. It's the brand new 8th edition. Now that's the other thing that's important. This data has not been out for decades. It really is showing up in the last 5, maybe 10 years, but certainly in the last 5 years. And we're learning more and more about the problems. And this is, again, you can go to the PSR national site and download this. And 577 patients just talking about the abstracts. This is not the entire article, but it allows you to see what is there, what has been written about, who's studying what, where is the study. It can get very complicated, but it also is organized so that people can look at it and read it. And that other link we'll put in the website actually will be able to reference this document. This is the other area. This is from the Physicians, Scientists, and Engineers for Healthy Energy. And the capacity, when you click on the repository for oil and gas energy resource, you go to this page, and you can see you can look at anything from air quality, climate, methane, community. I've opened up the health tablet and I went down, looked at hazard risks. And here are the studies. And again, they're alphabetically. You can see the years they were published, 2017, 2018, 19, not 2015, not 2000, not 1995. These are recent studies that are showing problems. And it's profound, the number of peer-reviewed medical and engineering and scientific literature that is showing the problems. Bottom line, though, strong evidence from hundreds of studies demonstrates that drilling, fracking, storing, transporting, and disposing of oil and gas cause serious harms to human health, including respiratory illnesses, cardiovascular disease, and impairment to infant and maternal health. Toxic air pollution and water contamination is accompanying fracking and associated activities everywhere, imperiling public health. And as I said, there's no evidence that this can be done in a safe manner. I will absolutely say there are good players in the oil and gas industry that do their best. They try not to have any unexplained leaks, but there are other players that really don't. They don't have either the infrastructure in place, they don't have the money in place. And we're also finding that many of the wells in Colorado are very low producing. It's not a big income, and they're not going to invest a lot of money if they're going to be, going into the negative amounts only to keep it safe. I mean, I'm sorry, but that's how industry sometimes works. This is a strong statement. The only method of mitigating this grave threat to public health and the climate is a complete and comprehensive ban on fracking. Now, we were just talking earlier that oil and gas, I mean, these are products that we use in plastic and many other things. I don't think we're ever going to be able to move away from it because we need them. But to burn them and to use them in such large quantities, that's a problem. So in addition to the documents that I showed you, many of those were on young people and infants, congenital heart disease, et cetera. This was published, as you can see, just this year in January. And it was a great study. It looked at 15 million, little over 15 million Medicare beneficiaries, huge number of person years, which is saying we're doing this is from 2001 to 2015. And they were looking at, is there any difference in a person's long-term morbidity, mortality, their likelihood of having disease, likelihood of dying, depending where they live? And if it is, where do they live and what is the potential cause? What they found was evidence of a statistically significant higher mortality risk, that is death, associated with living in proximity to and downwind of unconventional oil and gas wells. All right, so we know that if you're a family that is within, and Dr. Danforth is going to talk a little bit more about proximity and setbacks, but again, the closer you are to these facilities, the more exposure. Worries the devil out of me when it comes to my patients, especially my little children with asthma. But now we know with the Medicare study, this is not just going to affect the babies and the fetuses. It's going to affect all of us, and it just makes sense. It's not only going to affect a small group. From this study, these are the zip codes where they found the most significant problem. And you can see big time in Texas, Pennsylvania, Colorado, up into North Dakota, Montana. And guess what, gang? That's us. There's where we are. So we are living in a geography that has a higher mortality than the rest of the folks living in the United States. I'm not sure if it's worse in Texas, worse in Pennsylvania, but the bottom line is you can see the red showing problems. Those are the wells, but this is basically not a good thing for us. I'm going to switch gears. Who doesn't know about the problem with our water? This is Lake Powell. It's fascinating. I was there 20 years ago with my father and my two young children. Let's just say I didn't see this. We had a lot more water and we're in trouble. This is kind of dated now. The levels are even lower than they've ever been since they filled it up. Well, why did I bring that up? Over here on the left side, at least on my screen, I'm looking at what is this thing when we frack? Well, we all know that there's stuff trapped in rocks. How do we get it out? Well, after we drill the holes and put the pipes in with the fenestrated holes, we have to put something down that's going to break through the rock, frack the rock. And most of that is water. And most of that comes from surface water taken from rivers, streams. And this again is in Pennsylvania data. Public water, 20%. This is water, 83% of it, which is usable, drinkable. They will put some recycled fluid in, and then they add their marvelous chemical and proprietary ingredients. Well, right now, after they've done this, all of this water that used to be able to be drinkable is not anymore. But that's not at all. They take that, and here's what happens. In this study in Pennsylvania, to frack one well, now again, remember the well head goes down and you go perpendicular, goes down several miles, and it can go out for 5 miles in multiple radiuses. But the average in this area in Pennsylvania was 4.4 million gallons of water that went down the well. And what you have to realize, that's a bucket load of water, but it isn't water that we can reuse. In the Promethean Basin in Texas, the average well to frack bigger wells, longer, 10 million gallons of water, almost 16 Olympic-sized pools. And again, this is water that we can't use. Oh, let's be clear. So, well, let's just treat it and then we can bring it back. It's not that simple. The majority of the water we're never going to be able to drink and get back. There are some small areas, and to give it credit, they have some capacity, but I'm not exactly sure they can clean it up or they can identify the water that is able to go into these facilities so that it can come out and be used for agriculture or wildlife. So that, I would say, tells me that most of the water is gone, almost all of it. And what do they do with the water? Well, they put it back into non-using or abandoned wells, and they just put it in there with the hope that it doesn't leak out into the aquifer or it doesn't spill out. So it's kind of silly in a world where we're really dealing with drought and lack of water that we're using so much. How much? 3,400 billion liters of produced water each year is the estimate from the Groundwater Protection Council. All right, what does that mean? Here's where my engineering comes in handy. 3.4 times 10 to the 12 liters equals roughly 900 billion gallons. 900 billion gallons. The annual water consumed by over 6 million families. I kind of played with this. I said, you know what? If we know what the average family uses, which is about 300 gallons a day, this is roughly what the families in Texas will use in a year. Texas is the second most populous state in the United States. I just think it makes no sense while we know what we know about the drought and the lack of water, that we're taking useful water and putting it down in the ground, not only to never have it come back, but maybe even contaminate a potable, drinkable water. So big risk. Again, some people say the gain is worth it. I would disagree. So is there a link? We do know that without a doubt, these chemicals to expose to them are going to cause problems. We have the lethal dose. We know if we're exposed to a certain amount, it's going to be terrible. But then you have long-term chronic, which increases risk for cancers, increases risk for fetal developmental problems and congenital defects, and the endocrine system. Very scary in my world. I'm going to shift one quickly into the bigger picture. I was just at a conference for the Colorado Academy of Family Practice. We had a talk on this. I pulled 3 slides. And again, we're talking about health. And this is from the Lancet and in June of 2015. And the medical system is saying this could be the biggest global health threat of the 21st century. It can affect us all because of displacement, because of drought, because of heat stroke, but also air quality, vector ecology. I mean, we're seeing mosquitoes and other organisms that transmit disease move because now there's an environment where they can live where we never had them before. Obviously, the GI effects of potentially contaminated and infected water, again, lack of water, unclean water, forced migration. So this has global impact, but arguably this is going to affect all of us. We know some folks are going to have it worse than us, but this is, I think, a very beneficial slide because most of what is going to happen and what we talking about with ozone, with volatile organic compounds, I didn't spend too much time on particulate matter, but these are things that will get into our body, not only and damage our lungs, but be absorbed into our bloodstream and then create the problems. And again, it's not just the oil and gas, it's all these things. But when you look at the cause for wildfire, climate change, when you look at our drought and our lack of water, why are we taking water and moving it into the ground and never using it again? So my argument for those is this is a dangerous process. Unlike the old days where you saw the smog and look at how well we clean it up, this stuff is a lot harder to clean up. So we need to do more to take care of our population, more of our families, of our children, of our grandchildren. And I'd argue it's time for a Clean Outdoor Air Act that says it's time to fix this. And if the EPA moves us into that severe category, we'll start seeing that. But we need to keep working with our local government, with our city government, county government, state government, to enforce the laws and say, listen, this is not safe for us. Let's move on. So with that, I am going to turn this over to my colleague, Dr. Danforth, and he will take it from here. And Jim, I think you had the same problem I did. You didn't unmute yourself.
This way. Okay, good. Can you hear me?
Yes.
Okay. Hey, I want to thank our community values for the service that they provide to our community, bringing up issues that are contentious and need discussion. And so I'm thankful for that. Thank you for doing this tonight. And thanks to Dr. Corey Carroll. That was a great presentation, Corey. And one of the important things here, now I'm not going to try and duplicate, because I can't, what Dr. Carroll has just shared with you. We know each other peripherally, through the Larimer County Medical Society, but you've got two physicians who over the years have looked at this information and have come up with pretty similar findings. So I think that's one thing of value here. We didn't get together and talk about this and decide this is what we were going to present. I'm very pleased to be educated by what Dr. Carroll just shared with us. But I got interested in this about 12 years ago while I was still in practice, because it just seemed odd that we were allowing oil and gas development so close to communities. This is an industrial process with the potential for fires and explosions and whatnot. So I began to read about it, and I talked to the city council then, and their response was, Dr. Danforth, what are you getting excited about? None of the other doctors seem to be too worried about this. But over the last 12 years, things have changed a great deal. One of the organizations that I'm associated with is the Medical Society Consortium on Climate and Health. That includes over 30 medical academies, including the AMA, the American College of Physicians, the American Association of Pediatrics, the American Association of Family Physicians, which Dr. Carroll and I are members. And they represent over 600,000 healthcare providers across this country who are all calling for divesting in the harvesting and burning of fossil fuels. It's got to tell you something when that many people in the business of trying to keep people healthy are that concerned, because medicine tends to be a fairly kind of conservative, stodgy organization. So anyhow, what I'm going to try and do tonight is just summarize some of the things. I'm not going to get into the details that Dr. Carroll did, and I appreciate that he did such a great job. But these are the things that I take away after 12 years of looking at this information. And literally every day there are 2 or 3 more studies that I'm coming across that is making me comfortable and confident in what I'm saying here. Fossil fuels, when harvested and burned, produce toxic substances. There's no question about it. It is adding to the pollution to our air. It is not the sole cause, obviously, but certainly both harvesting and burning it is a big contributor. And right now, it's threatening our water supply, much like what Dr. Carroll was explaining. And it not only endangers lives, it is cutting short lives and may be interrupting lives in utero, because we're losing children, and we're finding out that this may be related to air pollution. And we'll talk more about why that is possible later here. And the damage to our environment is critical, and you can't really separate out harvesting fossil fuels and burning them from what's happening that we're living with climate change right now. They are infinitely connected. I threw this slide in. Essentially, it just is a summary of what Dr. Carroll was presenting. And it just is to remind us every step of the process of from the time the well pad is set up to the time the products of fracking are shipped out or piped out, hopefully. There are places where we're losing methane, and all of the toxic substances that Dr. Carroll laid out for you are leaking into the environment, and there's no question. In some studies, this industry is losing up to 7% of their main product, which is methane. It'd be kind of like running a dairy farm and going, well, you spill a little, it's not a big deal. They're being reimbursed so much that losing 7% is not a big deal for them. And based on current available peer-reviewed studies, there is no safe distance from oil and gas development that has been identified. And the studies that have been used to say, well, maybe 2,000 feet is okay. That was a study, well, there's actually two of them that came out in 2019. What they looked at is, are there any pollutants at the 2,000 foot level that could be a threat to human health? Well, they've used EPA air studies to determine that, but have not looked beyond that to say, well, why is it that so many studies that we know of are finding that people are getting sick who live beyond that? Well, much like the studies that Dr. Carroll introduced to you. And those studies were done at Harvard. And one of the studies that he brought up was about seniors, which I'm a little sensitive to because I'm in that category. Seniors living downwind from oil and gas development were dying at a faster rate than people who were not. And supposedly the levels of the contaminants in their areas of living were considered normal. So there's obviously a problem there. And this is the problem. The current techniques used to determine safe levels of exposure to fracking pollutants are not measuring cellular and intracellular and genetic damage that's actually causing the human health problems. They're relying on air studies. And, our health department doesn't even recommend, benzene levels in the blood. They just say that, that's not reliable. We shouldn't be doing those. Not even going beyond that to looking where the real problem is. And studies are now becoming apparent that the problem is intracellular. And it's difficult to get to that. And perhaps that's why our health is being harmed, even though the EPA levels would suggest that we're safe. Here's where our problem is. Last summer, we had over 70 ozone alert days, where for many of us, and on some days, all of us, not healthy to be outside working and exercising. This is a problem for young athletes, agricultural workers, people who are, up on your roof, replacing your shingles. This is a problem, for us right now. And the Colorado, wildfires, and those in California, are adding to our ozone and particulates. And ozone, as you see on the slide there, is a function of what are called volatile organic compounds, which are produced both from oil and gas development, as well as the cars running up and down on oil and gas on I-25. NO2 is another byproduct, can also come from agriculture, but good old ultraviolet we have plenty of in this area. Consequently, we have significant ozone issues. And last year, even in Rocky Mountain National Park, wouldn't you think if you go up to National Park, you'd be going to an area where air is pretty good? They're measuring 76 parts per billion of ozone in Rocky Mountain National Park. It tells you this stuff, and much of it is coming from Weld County right across us and right up into the mountains. The other contaminant there, particulates, when you mix ozone and particulates, you get smog. And in those days when we had the fires and everything, it looked orange when you looked up at the sun. Those are particulates and ozone together, and both of those are toxic to our health. As Dr. Carroll explained, ozone is an irritant. It's an oxidant, an oxidation agent, and it can trigger asthma attacks, and in the elderly, chronic obstructive pulmonary disease. And we lose about 12,000 people a year in the United States related to ozone episodes that trigger their systems to respond adversely if they have underlying health problems like heart disease. What we're finding out is that particulates are equally, if not more dangerous. Particulates are tiny. Basically, we call them 2.5 microns, and that means that they're 1/30th the diameter of a human hair. And the ones that are even smaller, 0.1 microns, are equally, if not more dangerous. They can carry the toxic chemicals that are released both in harvesting and burning fossil fuels. They can enter through the body, travel literally anywhere in the body. That means past the blood-brain barrier into our brains, across the placenta into the newborn. They can affect the heart. They can affect the kidneys. And I just read another study today on strokes associated with high levels of particulates on the days prior to individuals presenting to the hospital with a stroke. So this is dangerous stuff. And when you think about, how far do you have to be from oil and gas? How far is California from us? And when you think about the particulates and what they were carrying from what was burning, not only in the trees, but the houses, the cars, everything else, the chemicals that are present there, all can be carried into our bodies through hooking onto these little particulates and coming right in. So that's where the problem lies. Now, is adding 26 oil and gas wells, as the McWhinney plan is suggesting within Loveland, will that help us? No, it's going to add to unhealthy air. Much of our unhealthy air so far has been from Weld County. There are 50,000 wells in Weld County. Well, we're going to add wells. We're going to add 26 wells closer to us. It doesn't make a lot of sense. It does nothing of value for a community, and quite honestly, I think it's a detriment to our community. We got people driving in on Highway 34, and they're going to see for the next 20 years or 25 years, long after we're not burning fossil fuels anymore, that this community decided to frack some wells at the end of the healthy period of time for using fossil fuels. And the short-term severance tax, with our city council is already deciding we need to figure out how to spend, are not going to compensate for the next weather extreme that will occur. We will have a fire sometime in the next 10 years again. We could have, the fires that started up in the mountains could have burned right through Loveland if it hadn't been for the snowstorm we had in October. It's not going to cover the loss of life or health. It is going to increase our insurance rates already. Our insurance rates are predicted to go up 12% because we're all at risk for forest fires right now. So how about the cost of continuing to harvest and burn fossil fuels? Deloitte, which is a company that basically both does consulting and accounting, has stated that over the next 50 years, if we don't do anything about climate change, it will cost trillions. And they said 14.5 trillion if we want to get specific. And they suggested close to 1 million. They said 900,000 lost jobs over that period of time. That's going to be lost in the fact that people won't be able to work outside. It's going to be hot. It's going to affect the agricultural workers. And again, folks who work outside are going to just look at what's happening in India and Pakistan right now. These people are under extreme heat event. The trapped energy that's being generated by CO2 levels and holding the heat in is the catalyst. It's the accelerator for the extreme storms that we're having. The droughts, the vector-borne disease that is now moving further north as things warm up. The ocean level rises and the acidification of our oceans that's claiming our coral reefs, which is the source of, that's the incubator and the nursery for our fishing industry. So water is life, as we well know. Just got back from driving across eastern Colorado on the way to visit some family, and it's brown, and it's like basically the next dust bowl is close to occurring. The drought that we have, it's over 20 years, and they don't know when it's going to subside, but it's going to threaten our agricultural industry already. I saw an article today in Northeast Colorado in the Colorado Sun about the farmers who are trying to decide how much do I want to plant. I don't know how much water I'm going to get. It's weakening our forests. I was up in the Poudre Canyon the other day hiking, and in one of my favorite hikes at Young Gulch that burned 10 years ago, and they've had to reroute the whole hike. But you get back 3 or 4 miles and it's all burned, and there are no new evergreen trees growing. There's a little bit of aspen growing around the stream that comes down there, but it's been too hot and too dry for the evergreens to start coming back, and that is really odd and worrisome. It's going to threaten our multi-million-dollar ski industry as well. Really, the Vail Ski Corp and Aspen Ski Corp are saying, we don't know if we can afford the water that's going to be required to make snow to maintain our ski industry in 2050. They're taking this very seriously. And of course, our mountain snowpack and runoff is down, which means our water is going to be potentially threatened. And again, as Dr. Carroll did a great job of explaining, we've got a choice here. We can either use, and again in Colorado, last year, $12.5 billion of potable water that we could have used for drinking and agriculture. Or are we gonna shove it into the ground, take it out, and then find another place to get rid of it? And as he so eloquently put, I did it just by 1 year. The average American, 330,000 Americans use that amount of water in a year. This water is no longer available for human consumption. It is basically lost to the cycle of life. So that's it for me. I don't know if we want to have questions now or how Bob wants to run this thing at this point.
This is Lene. We do have a couple of questions that came up in the chat, and I would like to remind you, if you want to ask questions and you'd rather put it in the chat than to unmute and ask them, please put question in the front, but I'm going to take these questions anyway. So I had posted how you can get to the IQ Air Quality EPA sensor and look at the air quality. And one of the questions we have is, so even when IQ Air says our quality is good, it isn't? Should we never exercise outside or go hiking in Rocky Mountain National Park?
You want to take that, Jim, or I?
Well, it's a difficult question, and again, it depends on the day. I mean, some days, the AQI comes back at a level where, yeah, you can be outside, but certainly there are days when, if you are an individual who has risk factors such as asthma, or heart disease, or chronic obstructive pulmonary disease, it's probably not a good idea to be out there. So it's hard to take. You really have to look at that information and really look at what kind of levels they are getting. Now, I must admit, there is some controversy right now about what level of particulates is safe. After the last administration took over the EPA, there were a number of scientists who were working on that, who were kind of unhappy with the fact that they weren't listening to some of the new research that said that 10 micrograms per meter squared was too high, and that people were becoming ill even at that level, which would appear from some of the recent studies to be true. They suggested that level be reduced to 5 micrograms per meter square. Now, if getting back to the question that the individual asked, there is some benefit to using an N95 mask on those really bad days if you have to be outside. Just like inside, you should run your air conditioner, and you should probably get some other air purifiers for your home, because this summer is likely to be one of those fire seasons again. So hard to generalize, not knowing the information that the individual was exposed to, but those are some suggestions on those days when we will face air quality that doesn't look good. And if you can't see the mountains or something clearly 5 miles away, you know that the air is bad, no matter what they're telling you on the AQI.
I'll just quickly add, Europe and other areas have different levels, and they're all lower than the EPA and some of the regulatory agencies. Now, does that mean that we'll have a perfect world if everything goes away? Yeah. We've had methane in our atmosphere ever since we've had an atmosphere. The problem is the levels that we're having, the inversion with the mountains, the addition of these particulates. So it's getting worse, and we all know that. But to be, again, I showed you in 1968 we passed laws to clean up the air, and it worked. We regulated industries that were polluting. We said enough, stop, and it worked. We hopefully have the capacity to do that now. It's a little harder because you can't see it, and sometimes you can't smell it. And I don't think there's any buddy that would say, oh, well, here's a place where there's perfect air quality. But as Jim said, if you have a pre-existing condition, asthma, COPD, heart disease, be aware if you're going to go for a hike, what the numbers are, and do everything in your power to mitigate that, which might be, I'm not going to go hiking today. I'm not going to ride my bike today. And I have parents of children who are, as Jim was mentioning, athletes, and they'll look, and before they let their kid go out and run or bike, or they'll say, not today, the levels are high. So just be aware of that. And again, it's not, it's going to kill you. It's probably going to kill some people. And in the long term, it's not a good thing. But the worst thing for us to do is to crawl into our basements and hide. We need to say this is not fair to us, to our children. Let's do something to make it better.
So a second question, and it's been partially answered, and perhaps we could expand on that answer. Why does going inside during high danger days help? Isn't it all the same air?
Well, that would depend on what kind of a system you have. It's true that these particulates and ozone can get through, cracks in the windows. It doesn't take much to allow it to come inside. If you have a swamp cooler rather than an air conditioner, that's a problem because swamp coolers tend to pull air across moisture and bring it into the house. So that's a problem. If you have air conditioning, have a HEPA filter on your system, and perhaps even consider another air purifying system. There's all kinds of systems available. We have two in our house that we used last summer, along with our air conditioner, and changing the HEPA filter perhaps even more frequently than what's recommended. But that way, the inside air is going to be a lot cleaner than what is outside.
Healthy Homes, Fort Collins Indoor Air Quality Program, recommends at least a MERV 8, MERV8 filter for your system, and preferably one that is an accordion shape. And that catches up to the 2.5 microns of particulate matter. Our next question is on the same line. Can you effectively filter indoor air from smoke and other pollutants? And if so, what can we do for our asthma if we don't want to move?
I think Jim nailed some of that. I mean, back to the argument, is it safer to be inside than outside? And for some reason I'm blanking, but when we had the terrible ecologic disaster when we were growing wheat and in the fields, help me out, somebody. But the dust storm, and that. So when that process occurred, yes, sand would come in the house, but you would not survive if you were outside. And that's an extreme example. But the indoor capacity, you can shut out some of that. And hopefully if you have ways of circulating air and then purifying it, that's going to help. So if you definitely have somebody that's at risk, look at the resources. I'm not the expert on filters, but there are ways of helping your indoor air be better. The other thing that's really important is understand that, as I mentioned, inside our homes, we're burning fossil fuels. Move away from that if you can. Induction stovetops. I have an air heat exchange on my water tank. I'm going to move to a heat pump here shortly. So, think about how you can clean up not only the pollutants that are emanating from your basement because of burning the fossil fuels, but then have a healthier home by filtering your air and having systems to try to keep as much of the pollution out when it's a bad day, etc.
Also, I'm going to say, as a master home educator with Healthy Homes, I'm going to put a link in the list later in the chat, so you can go to the Healthy Homes website. A lot of indoor air is affected by the chemicals we use to clean our homes, and there are some alternatives that are offered. And if you're in Fort Collins, you can request a free service from us. If you're outside of Fort Collins, we've got an app and you can do your own investigation on that, how to keep your home more friendly to issues like asthma and sensitivities. So we have another question from Carla. With all the toxins in the air, don't they settle in our water supply and mix in to give us a tainted glass of water at our tap? Should we be drinking 8 glasses a day? Should we be using home decontamination filters? Or should we be importing our drinking water from safer environments like Washington State or Oregon?
I don't think I can answer that question. I don't know if Corey has a better handle on that than I do. Certainly there's a possibility that some of these particulates could filter out into the water, but I've not I'm not aware of any studies, and I don't want to speak on something that I really don't feel I have an adequate answer.
Yeah, and again, I'm not a chemical engineer, but the good news about the body is it has this incredible healing capacity. Even when it's perturbated, damaged to the point where there's maybe dysplasia and potential for malignancy, we know that people that are healthy, people that are eating healthy foods, that are, again, drinking adequate amounts of water, exercise. And again, here we're talking about, well, don't go outside and don't drink the water. There's got to be some midway ground. And if you take good care of yourself and you do as best a job staying away from tobacco, staying away from heavily processed foods, your body's amazing at fixing things. Though it's not an absolute end game that we're doomed, but there is a point where we are doomed, and that's the concern we all have, is we're ignoring this huge problem, and we don't need to. We can address it and move beyond it, and it won't be just Loveland or Fort Collins, but hopefully if more of our citizens, more of the world accepts that hazards and dangers, we can create a healthier environment where we all can thrive.
Okay, and thank you. I've got a question. My pulmonologist told me I could not filter my indoor air effectively. I hear you saying something different.
Perhaps the key word is effectively. I'm not sure, again, we're not here to battle this out, and I'm certainly not a chemical engineer or an atmospheric scientist. The HEPA filters will help. If you want to say, is there a system out there that'll clean it to where there's 0.000% of pollution? Probably not. It all gets down to how you're affected and what you can do to mitigate.
Okay. Another question that hasn't been touched on before. Will new satellite technology or specific measuring devices help correct the problem? I think the gas and oil industry believes they can drill and frack and not have leaks, and therefore it's okay to drill.
Well, they are using, and I think it's, I'm not sure if it's satellites or aircraft or whatnot, with infrared and air sensors to determine, where pollution is occurring, what's happening with the methane levels. That isn't gonna fix anything, but it might help us know where problems are that the industry could help take care of. But I would hope that at this point in time, after these two presentations, that you understand that methane leaks happen, and the industry has been unable to control that. And partly, they're using high pressures to both frack and move things, move the product, and it's almost impossible not to have leaks. And that's why, fracking is just one of those things that's a wonderful idea, but there was a reason why these fossil fuels were put under the ground, if you want to get philosophical about it. And we've kind of opened the genie's bottle by bringing it to the surface, especially after that slide that Dr. Carroll showed with Weld County and the number of wells over there. Even when you try and plug those wells, about 60% of them after 8 or 10 years are going to leak methane again. And as they leak methane is 84 times more powerful in affecting climate change than CO2 over the first 10 years. It's a big problem.
Yeah, and I hope the technology, again, what Dr. Danforth brought up was a 7% loss of methane. The industry, if I'm not mistaken, said, I think it's around 3%, 2%. And there's a critical point right there at 6-7% where that's really a tipping point for climate change and and the whole game. So it hopefully will hold people accountable. Again, I said this, if somebody tells you this is safe and doesn't cause harm or doesn't cause pollution, they're either ignorant or they're lying. Because the data is clear, the data is out there, and more is going to come, whether it's through satellite technology, the aircraft data, the collecting, the continuous air monitoring we're having in our communities. I really want to have one in the Fort Collins Loveland community, hopefully one in each, just to add to the Front Range, because it's showing us that the measurements that we're getting and the numbers we're seeing aren't always accurate. And if it's shown in real time, it actually has a positive effect on the industry to get them to clean up their act. Because now everybody can look and say, holy crap, look at that benzene spike that occurred there. And guess who else sees that? The industry. And they go, okay, what happened? We need to, because they really don't want to pollute and kill us. It's just a byproduct of what they do. And for them to do it right is extremely expensive and difficult. The argument is, even if they do it right, is that going to be something that's sustainable for us, for our children, for our grandchildren?
Afi has had her hand up for a little while. I think we should give her a chance to ask her question.
First of all, a comment to Jim. I was part of that SEAMS study. Have you heard about that? CEAMS? It's something at Colorado State University where they were trying to compare the measurements down here on the ground with satellite measurements. And I had a station out here in East Loveland, but I did not hear too much as a follow-up to that. So I don't know, because I thought it would be good, first of all, with I-25 traffic, and McWinney building up with extra traffic there and fracking coming in from Weld County. So you are not aware of that.
I'm not familiar with that study. I really had my head in the books looking at anything that affected health directly.
Right.
I'm sorry, I'm ignorant of that particular study.
No, but just check it. CEAMS, and it's like I said at CSU. It's a project from a graduate student there, doctoral student. And then the question why I raised my hand was, lately again, there's a lot of ads on the news or on the TV about how non-dangerous fracking is. And it just makes me very upset to think that they want to have it here in town. And what people here, now again, we are preaching to the confirmed, if you look at the attendance of this wonderful presentation, most, or I would say all of our gas and oil goes down to Texas via pipeline. And I know of a few fracking sites when we were involved in the first memorandum, where they could not start fracking because that pipeline was not connected close enough yet to some fracking sites. So how do you tell people? Does that reflect the truth? Is it really that we do fracking to export, make some people richer by ruining our health?
Well, there's no question that the oil and gas that would be collected would end up somewhere, and I can't tell you where that might be, because these are people are in business and they decide where things go, and of course we have a refinery on the outskirts of Denver called Suncor.
Yeah,
which is one of the highest polluting refineries in the country, and their air doesn't stay down there. It follows us as well. So, I was a little disappointed. I saw a letter in the paper from an individual who had gone on one of Troy McWinney's, show and tell sessions. To say, well, these are where the wells are going to be, and this is what's going on. Well, I don't know what he was told, but what he put in the paper was entirely erroneous. I have on 2 occasions just reached out to Troy McWinney on a personal level and just saying, Troy, can we sit down, over a cup of coffee or a beer and talk about, where you're coming from and what concerns me as a physician, he has not accepted that invitation. So I don't know what he is telling people on his trips, but
But he says he's not an expert. He says he's not an expert on fracking, but he has been told that there's nothing wrong with it.
Well, some people don't want to know what they don't want to know.
Exactly.
That's all I can say about that. But
Yep.
Let me
Thank
break
you.
it here a second, folks. Thanks, Eva. Yeah, McWhinney, I've gone through his presentation like many people have, and if you look at it closely, it's what he doesn't say that really counts. He tries to portray this as an absolutely safe operation and is not giving us all the information. It's obvious. A couple of side points, and I know we may have a few more questions here, but there's a woman that was Dr. Theo Colburn. She's since passed away. She came out of retirement back in 2013, 2012, when fracking started out around Rifle. She's an endocrinologist. I hope I said that right.
Yep.
And she was going into some details on what's happening in parts per billion, which we're not testing for in many cases. And if you just go to YouTube and key in Dr. Theo Colburn, and you'll get a whole series of presentations that she gave. That's one of the things that got me involved in this many years ago. Those presentations are pretty direct. The question came up about our city council. The Loveland City Council was personally invited to this presentation. You can see that we have no attendees from it. This presentation, by the way, is being recorded, as you know. If you go to YouTube, you can key in our community values as a search. Our logo will pop up, and you can go to that site. It's our channel. This presentation will be up there along with the other presentations we've had so far this year. So if you want to go back and review some of this, you'll be able to do that. One of the arguments here, which I found interesting, is we're burning fossil fuel, and people keep saying, well, we need fossil fuel for all the plastics we develop. And that is true. But every time we burn fossil fuel, we are eliminating the ability to create plastic out of that fossil fuel. So there's a second kind of a side argument to this, that we keep burning this stuff and destroying it. And I love the thing about McWhinney talking about how safe the water is in fracking. I made a suggestion and it got ignored. If that water is so safe, why don't we satisfy the folks that want to keep Lake Loveland full and just truck that water over to Lake Loveland to produce the water coming back up? Obviously, no one wants to do that because the harmful chemicals that are in that water is beyond belief, including some radioactive material. So that's why that water gets permanently embedded back in an injection well. There's one other point I wanted to make. Colburn. Oh, snow. You know, it's interesting. I started skiing many, many years ago. We weren't making snow in those years. It was all natural. If we shut down snowmaking in the mountains out in Colorado here, that will end skiing. Without snowmaking, we don't get enough snow for skiing. So our climate has definitely changed since the 1960s. And anyone that denies that is dreaming. As Dr. Carroll had told us, they're either ignorant or they're lying to us. And I hate to use that term, but that is kind of rings true. Lene, you want to open the rest of the questions here? Or do we open it up for just general comment? We're down to about 20 smart people here. We can just open it up for general comment and have folks just discuss what's going on.
Well, I would like to point out that Tim has notified us that the city of Fort Collins has some rebate programs. This is something we can push other towns and cities to do, that electrify home appliances, eliminating fossil fuel burning ones. He had his gas hot water heater replaced with an electric heat pump, and it's great. And he also put a link in there to how to get to the Fort Collins rebates. And so thank you, Tim. I'm perfectly happy to open it up and let the people whose questions have not yet been answered ask them themselves.
So let's go in that direction. So folks, if you want, just unmute yourself and we can have a general conversation here. We're down to about 20 people, which means it will not get too unwieldy. The only thing I request is we be respectful of each other, okay? So let's go. Who wants to unmute themselves first?
Not that I want to ask a question, but I don't like silence. But here's a quick add-on, to Evie's question, Evi's question. What about the news that this is good and safe? It wasn't that terribly long ago that the tobacco industry was really upset with the Surgeon General when they put into the Congress the potential hazards of tobacco. And they went at him and every other opponent of tobacco with everything they had. Look at the Statler family and opioids. So this argument that, we're hearing this is safe is, I don't want to say ingenuous. Yes, I do. I want to say it's disingenuous. These are people that are making tremendous amounts of money and they don't want to stop. And they're really not that concerned about the outcome. So, like I said, show me one study that shows it's safe. Show me one study that it doesn't have harm, and I'll absolutely read it, but it doesn't exist. So when you hear these things, when you see these things, when your friends tell you that, to me, it isn't, they're lying, but you can just say, well, gee, we have the same issue with tobacco industry and the pharmaceutical industry and opioids where they really didn't want to tell you the truth. Jim and I can tell you how many drugs have been pulled from the market because the trials that they were doing, they just didn't share with the fact that people were dying when they were taking these medications. And it took an investigation. And finally, that's how they got pulled. But they weren't going to share the truth. They were going to lie. So just point that out to your friends who tell you this is, I'm hearing this is safe. It's like, well, who are you hearing it from? And as Jim pointed out, who are the folks that are concerned? The people that hopefully want to help you and care for you, not McWhinney.
I think those are excellent points, which the other point I wanted to make, we did put thanks to Linnea, we put our legislative contacts up in the chat if you scroll up. One of the things we can do is let our legislators know where we're coming from. And I have personally sent several studies to our city council. I think those studies have to be sent to other folks and stress the fact that this is peer-reviewed science. This isn't somebody sitting in a back room making stuff up. This is stuff that's real. And the compendium has a lot of that information in it. If you want a source of information, I would highly recommend going to it.
Yeah, I could make one comment. There's the question, well, why don't we just, with this high, energy cost in Russia and whatnot, but let's just generate more oil and gas. Let's, frack more and that'll solve the problem. Well, prices are high, and ExxonMobil and Chevron are going, hey, sounds good to me. Essentially, what is being reported is that they're essentially not looking to open up any of their leases that they already own, and it's in the thousands of leases that are available. They are buying back stock, what they call buying stock options on their own stock, and giving their investors dividends. Because number one, when the price is high, that's good. If you generate more oil and gas, you got more oil and gas, and the price goes down. It's just basically basic economics. And there was one. I was going to read one statement that the UN Secretary General Guterres, after the last IPCC meeting, said, investing in new fossil fuel infrastructure is moral and economic madness. And these companies are in the business of making money, and if they think after 1 or 2 years, when the price of fossil fuel starts going down as renewables go up, they don't want to have just invested millions and perhaps billions of dollars in new infrastructure that they're not going to capture additional money on. So they're not trying real hard to produce more oil and gas at this point in time. and it's a business decision. And if you were in that business, I understand. The average oil worker, I don't have a problem with those individuals at all. I mean, but I don't know if any of you saw the PBS specials that it was called Big Oil. There was basically a 3-hour program. From 1979 to 1983, Exxon had a special division of their company that was looking at CO2 in the atmosphere and what might be occurring and what kind of problems it could cause. And in 1983, when prices started to drop, they literally told these engineers that were interviewed on that program about what they were doing. They said, well, guys, we're not going to look into this stuff anymore, because they knew from their own studies back at that time that increased CO2 in the environment was going to increase the heat and cause a change in climate change that could be a serious risk to the climate. And they shut that down, just like Dr. Carroll was saying. That's been the modus operandi, whether it's smoking or getting lead out of gasoline. There's a book called The Merchants of Doubt. And essentially what these individuals were doing is shutting down their information that they had and saying, well, we really don't know. There's always can be some doubt that this climate change is for real. But all the time they knew from their own research that it was coming if they continued to produce and burn fossil fuels. So I'm not a real fan of the folks that run ExxonMobil for that reason.
Yeah, well, points well made. One of the things that I know I've faced here, and I'm going to take a little diversion here. Our community values is nonpartisan. We try to stay that way. But when you present science, to me, that's not a political statement. Yet with the people that try to introduce doubt into what the science is telling us, that becomes partisan. And we've heard a comment about, well, we're being partisan tonight because we're presenting one view here, which is the view of science and what's happening to our atmosphere. Colin Powell made a statement, not Colin Powell, DeGrasse Tyson made a statement here a long time ago about both sides of a presentation being put forth. And he said, when a flat earther comes to me and wants to get equal time to talk about whether the earth is round or not, he said, I really ignore them because there's no science base there. To some extent, that's what we're doing here in our community values. When you present science, that's what you got to look at. And somebody coming out with opinion, they're welcome to their opinions. But give me backup. And as Dr. Carroll said before, show me any qualified or peer-reviewed study that says this is absolutely safe. There are none. There's many studies that coming down the other side, as thank you for the two physicians tonight that have instructed us on. Okay, I didn't mean to interrupt there. Anyone else have a comment?
Yeah.
We're an hour and 20 minutes in or so.
As Dr. Danforth and Dr. Carroll very well know, is that if you work in medicine nowadays, if you do not work evidence-based, same for a hospital and everybody who works in a hospital, if anything goes wrong, you're from the get-go, you're wrong. You're on the wrong side then. My problem is that, we are trying to base our opinion on science because it's probably as close as we can get to the truth. And I think, like everybody, we need to be open to adjust because we will know more in 10 years, in 20 years, in 30 years. It's always been that way. My issue is that where is the health department in this? the health department employs taxpayer-paid individuals who are supposed to work for taxpayers and for our health. I think I brought that up last time when you had a presentation. A small group of us, we were trying to get city council to start talking about not putting fluoride in the water anymore. And, you know, I told you we have the same issues. We went into this very science-based, and it was totally ignored. There was a representative from the Larimer County Health Department. There was two from the State Health Department. There was a pediatrician there, and I didn't understand her opinion and her stance at all. But the health department people had not one comment on the science that was presented. They acted like they hadn't heard it. And I'm afraid, you know, what you're doing here, or what we are doing here, is the same thing. You know, we are convinced because of hopefully good science, but we are not able to convince the decision makers, which in the case of fluoride, of course, is city council, but city council got advised by the utility commission, and they had a meeting and they just had us all talk. There was no discussion. Nobody even accepted or seemed to notice that any science was presented. And it wasn't just us as lay people who presented. We had somebody from the Fluoride Action Network, and it didn't make any difference. So I think there needs to be a framework where these health decisions and concerns need to be brought to the decision makers. And we need to probably develop a group that bases their opinions on science, but can develop more power.
My comment here would be, I think Dr. Carroll said this earlier on, if you keep getting the same result, you know, if you keep doing the same thing, expecting a different result, that's a sign of something I won't mention here. If our policymakers are not, thank you, Diana, I didn't say the word. If our policymakers aren't following what we believe is the science of the day, then the way to change that is change the policymakers. And that means a very concerted effort on the part of voters to get out and pay attention and
Yes.
vote. I happen to be tracking a lot of the voting going on in this community, and the apathy on voting is scary. Even though Larimer County is one of the highest voting counties in the state, there are still thousands of people that don't bother to vote. So I think it behooves us, as the few people remaining on this thing here, to spread the word that if you want to change the policy, you have to change the policymakers. That's the only way it happens. If you don't do that, you're going to get the same result you had before. So
How do you get the information out to the public?
when you have the answer to that, let me know. We're trying here, and as I said on the last presentation, please have people go out and spread the word when you get an email from our community values. Spread that email to everybody on your network. Tonight, we had 57 people sign up to come. We sent out a reminder this morning to remind people here, and we had a total of 27 people actually attend. That's 50% of the people that signed up. We've had the other presentation we had over 100 sign up. We had 50 50 actually show up. So we're running about 50% of the people that show up. I don't know the answer to that. We're trying here the best we can. You can always respond to, our community values email if you have ideas on how we can improve or expand our network here. We're trying, and I will keep doing this. I know Lene is fully engaged. We have our treasurer, which was unable to be here tonight, Nancy Clark. We have some people that are really attempting to spread this word. But unless we expand this network, it becomes an echo chamber. That's fine. I mean, I enjoy the presentations. I enjoy the little bit of work I do here to make it happen. But if we're talking to an echo chamber, we're not helping. We've got to.
But Bob, I mentioned that last time. As long as we, as different groups, don't cooperate, you are the RNL group. No, you are. What is your group called? Common Health Concerns. We have RNL, we have Protect Our Loveland, that we used to have. We now have the High Plains area. There's two different groups. If we don't start working together, we'll never get anywhere.
But that's it. Eva, I 100% agree with you. There's a website, there's a Facebook page for Loveland on anti-fracking, right? Or on a fracking issue. I won't say anti-fracking, but they're obviously against fracking. We've tried to work with them. I've gotten almost no response. So we ran 3 series. This is the 3rd presentation now we've done on fracking, and there was very little crosstalk. So I don't
But
understand.
thanks for letting me know by your emails. I appreciate that.
But that's our network, right? And
Yep.
I'd like to expand that network. But if you have a group of people talking on one area and you're inviting them in, and it doesn't seem to be a response, I wish I had the answer to do that. Okay, I don't.
Isn't there a Larimer County Health Board of Health?
Excuse me, Trudy?
Isn't there a Larimer County Board of Health?
Yes,
Does
there is.
anybody know about that and have experience with? What do they do?
Well, I'll quickly respond. Unfortunately, the evidence with medicine, it takes about 20 years for the physician community to adopt to a new, I mean, you think we're all cutting edge and we're going to accept things, but first off, many of us came out of medical school without any training, and forget environmental exposures, but nutrition and other things. So there's a, this is just the reality of life. So the medical community, there's going to have to be an acceptance, and it's not necessarily evidence-based medicines, it's standard of care. So, physicians to do things that are not being done by other physicians, even if they're found, I mean, let's look back at George Washington. He died from bleeding for a sore throat. Well, that was standard of care back there. I think if somebody said, I want to give you penicillin, I don't know, they might have tarred and feathered him. But the point is we have to deal with the realities of our world. And I appreciate, even there's a small group here, talk to your friends, talk to your kids, ask them to, if there's questions. If people say to you, well, we see this as safe, it's like, well, here, have it on a card, give them, watch this recording, see if you, think something different after you've watched that. But I think, we're living with the realities of the world, the economic realities, the inability for people to change their mind. I mean, oh my God, let's not talk about the deniers of climate change and COVID and not anti-vaxxers. I mean, it's just, it's bizarre to me, but here we are. And we just have to do the best we can and keep pushing. And I'm optimistic that we can make that. I wanted to point out really quick that fracking is not sustainable. We pumped the oil out of the ground that was easily accessible because it was in pockets and it just came out on its own. Well, that's all gone. I mean, there may be in Saudi Arabia, but this is going to be all gone, and they can't put enough wells in. And then there's a point where you're not going to have a return on your investment, as Jim pointed out. So this is limited. And why are we, as a country, saying, oh, here's this sustainable energy source, the sun, the wind, the geothermal, there's all sorts of different things that are coming down the pike. And it's sad, again, that we have this group that thinks, oh, this is the answer. And in the end, it's not sustainable. It's dangerous. It's accelerating our demise. We have to keep pushing that and point out the obvious to the people that disagree. And I like what Dr. Danforth was saying is like, well, I'm going to talk to Troy McQuinney about his legacy. Do you really want to be known as the guy that basically helped destroy Loveland? Probably on deaf ears, but that might be a way to crack the egg. So keep working and do the best you can, but don't let people tell you it's safe. Don't let people tell you this is no big deal.
Another point here is, as you said, it's not sustainable. The average well loses 40% of its production in the first year. So you've got to punch another well in order to make up the difference in that production rate. And that's almost like a pyramid scheme because you're going to run out of areas to frack pretty quick. And when you have to go back in, Dr. Carroll mentioned before how much water it takes, and so did Dr. Danforth. Most wells get fracked multiple times because of the reduce in production. So it is totally unsustainable. Anyway, folks, we're an hour and my clock here, an hour and 40 minutes in. We're down to a small group. If you guys want to continue, I'm more than happy to stay. If not, I'm going to encourage folks, which I didn't do in the beginning of this. There's a survey at the end you're going to see pop up. I'd appreciate you answering it because it does help us. Stay tuned. We'll put out an email probably in a week with what our next presentation will be, which is the last Thursday of next month. I don't have a calendar in front of me, so I don't have the date. But that survey helps us moving forward. Okay, I'd appreciate if you take it. I don't have anything else tonight. Does anyone else have anything besides thanking our two guests here, Dr. Danforth and Dr. Carroll? I can't thank you guys enough for presenting because this information is essential. We get it out and keep hammering at this. And we do have to keep hammering at the science and what it's telling us about what it's doing to our body. So with that, anyone else have anything?
I'm wondering, we still had some questions in the list. Did anyone feel that their question was overlooked?
Yep.
We didn't get to all of them. If you want to ask the question, you can now.
Well, forever hold your peace.
That's a different ceremony.
Oh, gee, okay. Thank you. All right, folks, I want to thank the few that are still left on here for coming. Keep tuned here, and I will make a plea to a couple that are here. When we send out the next email for the next announcement, please share it to your network, on your Facebook page, whatever else you have. And this presentation will be up probably by tomorrow night, hopefully, on our YouTube channel, okay? It's there. And the other presentations are there. There's also a presentation by Andrea Myers, who talked about our election system. So that presentation is there also, okay? Any comments or anything else you want to do, you can always hit our email address, which is ourcommunityvalues@yahoo.com. Simple, all one word, all lowercase, okay? Thanks again, everyone. Thanks, Lene, for your work here. And again, Dr. Carroll and Dr. Danforth, thanks a bunch for putting this together for us, okay? We appreciate it. Good night. Have a good one, guys.